It is September the 2nd, 2020. It is 5:15 p.m. I will call the meeting to order at this time. I will introduce myself. I am Betty Ann Nettleson. I'm one of the two Elmore County representatives, along with Representative Megan Blanksma. And I will tell you that we do not have any representative from Boise County on the call today. So starting with Elmore County.
Representative Blanksma, present.
Ada County.
Ted Epperly, present.
Diana, are you there?
Commissioner Laciando, present.
Jane Young, are you there?
Yes, I'm sorry, Jane Young.
Okay, thank you, Jane. Valley County.
This is Commissioner Hasbrook. I'm present.
Okay, thank you, El. Okay, moving on to our action items. We will go to changes to the agenda, and I will defer that to Director Duke.
Madam Chair, this is Russ, and there are no changes to the agenda.
Okay, thank you so much. Okay,
Madam Chair,
on.
Mike Kane, can you hear me?
Yes, Mike.
For the record, you said September 2nd is actually September 3rd.
Oh, thank you. I'm only a day behind now. That's pretty good. Thank you for that. Okay, under new business, number one is a hearing on the petition to reopen bars, and I'm not sure who wants to lead this discussion, Mike or Russ, or is it Mr. Leroy?
Madam Chair, this is Kane. This is a petition under the Administrative Procedures Act, and the presenter today will be David Leroy on behalf of the bars in the city of Boise, Ada County. He will go first, and then a presentation by district staff through Russ Duke. The board will have the opportunity to ask questions of each presenter, both the petitioner and the district staff, and then there should be a response by either petitioner or the district staff and further questions by the board. So it's fairly informal, but it is under the Administrative Procedures Act, and we are recording this. So with that, if the board thinks it's appropriate, it would be a good time for David Leroy to make his presentation.
Okay, thank you, Mike.
Thank you, Madam Chair. Am I being heard?
Yes, I can hear you well.
Excellent. We're grateful, Madam Chair and Director, Mr. Kane, to come before you today on this very important matter, certainly vital and important for the district and also for my clients. According to the Alcohol Beverage Control people of the state of Idaho, we've got about 363 bars statewide, 74 of which are located within Ada County, 54 of which are located within the city of Boise. I was Googling today and found an enterprise named Yelp that predicted as of July 22nd, literally more than a month ago, that about 44% of all of the bars in the United States will never reopen again by virtue of the situation in which we've all found ourselves. I represent, as you know from I presume the written material, about 12 of the Boise downtown bars who are owned by 10 people. 7 of those individuals are here with me, arrayed behind me in my office today. We are petitioning you on behalf of ourselves and frankly, by virtue of the terms that we approach all other bars similarly situated within your Ada County jurisdiction, to look at reopening our premises under appropriate protocols. And we do that because we, of course, experience grave economic consequences. Each of us has substantial thousands of dollars of overhead every month, even if closed. We have landlords some of whom have forborne our rent, and some of us who have gotten 3-day notices. Each of our bars has about 25 employees, and they, of course, have suffered greatly. Our faithful patrons are, we hope, waiting to resume, but we're not certain of that. So we, of course, are mindful, as I know you are, of the economic consequences to our businesses and every one of us by virtue of this COVID. We're also mindful of the fact that back in June, we opened for an approximately 2-week period, and our patrons, some of whom were far too eager to get together on the weekend of June 5th and 6th, caused what CDH has determined was a cluster of approximately 37 cases detected on or about June 11th that resulted in another 2.5-month suspension of operations for ourselves. But I want to tell you that we don't approach you just as to economic consequences and closures. We approach you seeking to be a full partner in protecting the public health going forward, and we believe that we can honestly deliver that for ourselves and for our patrons under the terms and conditions which we petitioned, and under the terms and conditions which we work with staff and with the city of Boise to present to you today, hopefully for your favorable endorsement. The history of the applicable orders is relevant here, and I won't belabor it, but because we're asking to amend orders, we need to have you understand with precision what orders are on the table. Of course, this process began with the March 13th emergency order of Governor Little and the consequential closure that pertained to us and most other business operations for approximately 2.5 months thereafter. On or about May the 30th, the governor, in the light of favorable numbers, contemplated a bar reopening and began to move forward to authorize that, leading us to the June weekend and about a 2-week period that I previously referenced. When you detected the cluster on or about June 11th, you acted on June 22nd to order a quarantine restriction that eliminated any bars having customers on premises and being open to sell to any of those customers. That led us back to stage 3 limitations from the governor's proposed stage 4 limitations. And as of July 14th, you ordered, in addition to the June 22nd, 24th orders, all bars and nightclubs closed. However, in your order, at paragraph 4, you made an exception allowing either the board or Administrator Duke to, on a case-by-case basis, take a look at bars and determine whether exceptions could be made. It is under that paragraph 4 of your order that we come back to you and ask you now to make those exceptions subject to the strict conditions, limitations, and protocols which we have proposed and which we have discussed with your staff. After you adopted your July 14th order, the city, on top of 3 prior orders, June 23rd, June 25th, and July the 2nd, issued a 4th Boise City mayoral emergency order, and that, as did all of the previous ones, incorporated by reference your findings and your concerns, and at the city level endorsed a mandatory closure for all bars, allowing all businesses to open, and significantly allowing restaurants and others to operate under various protocols, which we attempt to move toward, and in fact propose more strict ones now. But again, the city and the district, as of June 14th and June 15th, under those now still currently operating orders, have mandated us to close. We ask you by this petition to amend your order, and I'll have some information for you about what Boise City is inclined to do, should you do so on appropriate findings. With that history of orders, we, having examined it and on or about August the 12th, filed this particular petition. It runs 7 pages. It's directed at subparagraph 4 of the July 14th order. And on behalf of our bar owners, we proposed on pages 3 to 6 of our petition certain protocols and conditions by which we would propose to reopen. They were much more restricted and much more detailed than those under which restaurants are now currently operating in the county and in the city. They dealt with employees. There was a section that dealt with premises sanitation, a section that dealt with how we would treat customers and rules pertaining to customers. And there was also a section in that petition talking about tracking and reinforcing our obligation to promptly report if we had any kind of circumstance of a violation or a concern. We would report directly to the district. That initiated over a course of about 10 days, with Director Duke taking the initiative as he was authorized to consider doing in the paragraph 4 provisions. A dialogue with your district attorney, with the city attorney, with the city economic director and Director Duke. And those talks resulted in a stipulation of some 4 pages, which I believe you have before you now. On behalf of my petitioners, I have signed off on that, indicating that we are each and all jointly and severally agreeable to those terms and conditions for possible reopening. You'll find that, for instance, paragraph 3 has some findings that your staff has found that there's enough of a decrease currently that we can consider moving forward on this basis. Paragraph 6 points out the virtue of having all of the bars and all of the operations of a bar and nightclub nature under your jurisdiction signed off on a single protocol. As you know now, some of the bars have from time to time operated and gotten permission to operate as restaurants, although their basic operations have not greatly changed, etc. But it is of importance, I believe, that paragraph 6 notices, promises, as do we promise, that all of the bars operating under this protocol are a great and significant benefit to the advancement of public health. And then finally, at paragraph 8 of the proposed stipulation, there are terms and conditions under which we would operate and propose not only to reopen, but to stay open. There are some 14 specific limitations and requirements. There are occupancy limits, there are employee training, face covering, gloves, sanitation in terms of hand washing and sanitizers. There's a surface sanitation standard. There are issues related to the limitations on consumption being only at tables, consumption and food service. We adopt the 6-foot spacing standard that is common. There are barriers, if required, noted. We pledge to utilize maximum seating outside to the extent possible. All our dance floors are and will remain closed until further order. We have single entry doors so that we can enforce those occupancy limits. And we talk about signage requirements in various places, including the front door of the establishment. And we, again, repledge our enforcement obligations to let you know if any and all issues come up. And finally, and very significantly, we also pledge to work with your staff on a premises by premises basis to present a plan for each such premise that shows that we are indeed in compliance with all 14 of these standards and intend to be going forward. I need to tell you that as of today, having been fully informed of this set of standards and protocols and the proposed action of the board, the city of Boise has signed off and indicated that they are willing to go along with your order in this regard, should you permit reopening. As of 2:35 today, I received, as did Mr. Kane, a email from the city attorney, which reads as follows. I see on the CDH website that tonight's special meeting will be live streamed at 5:15. The city is ready to respond to any action CDH might feel appropriate, if any, in our emergency orders so that there is continuity for the community and businesses within city limits. Thank you. The email is authored by Jamie Sullivan, City Attorney for the City of Boise. And finally, let me say that, the governor was on at 11 o'clock this morning, indicating that he will propose that we stay in stage 4 of our recovery programs. You need to know that there's nothing about that that's inconsistent with this particular set of standards and this proposed reopening. Back on June 13th, the governor himself proposed stage 4 reopening standards for bars and breweries, wineries, distilleries, and nightclubs, etc. And in fact, there are 6 standards mentioned there that the governor would recommend, though, as we all know, he has deferred these issues more specifically to you for your hands-on and expert management. But the governor's stage 4 recommendations are simply limit occupancy, which is covered in this protocol, space tables appropriately, which we're doing, eliminate the use of waiting and standing areas, which we're doing, space seating at counters at least 6 feet apart, etc., which is pledged in this protocol. Have food and drink served at tables is one of the governor's standards covered by us. And finally, employee limitation of exposure by requiring face coverings, gloves, etc. All of the governor's standards in stage 4, which he wishes to continue to be in statewide, are covered and adequately addressed here. There's no inconsistency with the governor's mandate, even though he has directed you to be the front line in this matter. Accordingly, we are earnestly petitioning you to review this proposed stipulation closely and carefully for the recommendation of your staff, which I hope will be in the affirmative, soundly endorsing this reopening. And we in turn pledge to you to be very effective and good partners in protecting the public health in the county of Ada and the city of Boise and in any other area of your jurisdiction where your patrons come to us. Thank you very much.
Okay, thank you, Mr. Leroy. On the agenda, they are the questions from board. There is an opportunity for you to answer questions now, board members.
Madam Chair, this is El.
Yes, El, go ahead.
Mr. Leroy, I think the biggest effect on this order is really the capacities on different size bars, and I just want to make sure that all the bar owners are good with that. To me, that's going to be whether it's going to be successful or not. Is how are you going to turn people away if your facility is full?
Commissioner, Madam Chair and Commissioner, yes, paragraph 8A of this particular protocol, the proposed stipulation, addresses occupancy, and it says that businesses with occupancy permits of under 200 shall not exceed 50% of posted occupancy. I don't believe any of our bars exceed 200 in permits, and there may be others in the Boise or Ada County that do so, but they would have to approach the staff with a particular plan and pledge to meet those. You can see in that same paragraph that 30% occupancy is permitted between 200 and 500. 20% occupancy, meaning a cap of 100 people, is permitted at over and above 500. So in answer to your question, I reaffirm that we are committed to those occupancy caps. And you will find also that back in paragraph M of the stipulation, each premises will utilize its security personnel to enforce these safety protocols, including physical distancing. That will specifically be as to the occupancy limits as well. That's one of the reasons that we're limiting entrance and exit for patrons to a single door so that we can have an adequate count. we are committed, as you suggest we must be.
Thank you.
Thank you, Mr. Leroy. This is Chairman Nettleton. Any further questions from board members?
Yes, Madam Chair, this is Diana.
Yes, Diana, go ahead.
Thank you, Mr. Leroy. So I'm taking a look at the proposed regulations, and I am noting that all employees will wear a compliant face covering for the entirety of their shift. I'm noting a emphasis on physical distancing among patrons, but I am not seeing what the plan is for face coverings among patrons. And I understand that when one is obviously physically eating or drinking, that is not possible. But many restaurants are requiring it upon, or they should be requiring it upon entry. I've noted when Hannah's opened as a restaurant, after some initial problems, they began handing them out in line. And I'm wondering what this group is proposing related to face coverings.
Because we, Madam Chair and Commissioner, we hadn't more particularly addressed to that with your staff than is covered in the current text. We're certainly not inclined to any objection in terms of having people present at the front door with a mask. Obviously, when people are in our premises, they are intending to drink or to eat, and I presume that's why we did not have any other standard but physical distance and requiring that people maintain that physical distance at our tables, either individually or with their groups, while they are on the premises, presumably eating and drinking. If more particularity is there needed there in terms of presenting or entering, we're certainly not objecting to that sort of restaurant-like standard.
Okay, thank you. Sort of going along the same line of questions about the chair. Hear me. I'm not seeing anything in here that limits group size. And if you have a small group, you know, say 4 people perhaps that are sitting together, but I don't see what the plan is if there's a bachelorette party or employee group, etc. And they would all be sitting at a table together in close proximity in the indoor space, sharing air space. So what's the thinking around that?
Madam Chair and Commissioner, once again, we did not have a particular standard for that. And most of our bars are set up to have small groups. Those groups present, some are family members, some are close friends, and we did not have a protocol to determine the affinity or closeness of relation of any of those parties, nor did we address with the staff a maximum group size. I don't believe that our bars generally, my clients generally, have huge party rooms or are the kinds of premises that we're seeing in terms of restaurants that more particularly cater to those kinds of events. Because we do not cater to those kinds of events generally, we had no such standard discussed with staff.
Madam Chair, I'll yield. I have more questions, but I want to let someone else pop in here.
Betty Ann, this is Ted Epperly. I've got a question for Mr. Leroy.
Yes, Ted, go ahead.
Thank you. First, Mr. Leroy, thank you for the presentation. One thing that always becomes an issue, especially if you start to socially distance within the bar, is what happens outside of the bar on the sidewalk. And I recognize the jurisdiction of the bar isn't involved with the sidewalk. That's the city's jurisdiction. But it's problematic, of course, if we've got 30 people stacked up in a line waiting to get into a bar that's already limited in regards to capacity. So my question to you is, have you proactively talked with the city of Boise or the Boise Police in regards to how the line management happens because in a recent photograph that was widely published, we had quite a few people outside of a bar/restaurant that clearly were not practicing face masking, clearly were not following social distancing. What would you say in regards to that?
Madam Chair, Doctor, we have talked among ourselves about that, and that is one of the reasons that we strongly emphasized and particularly identified that our security staff would enforce social distancing and other regulations. You're correct that we do not have absolute jurisdiction to dominate and dictate on those sidewalks. However, each of our security personnel at the front door does have some ability to the extent that between the sidewalk and some of our premises entrances, there are private lands or lands over which we have control, and we continually assert that control. Likewise, we do our best to enforce the immediate area of our sidewalks, but we have not satisfied ourselves in terms of any particular dialogue with the local police or the city jurisdiction that we would have some extraterritorial authority to order this or that or the other thing. But as you can tell by virtue of the terms that I've mentioned in this protocol, we are sensitive to that issue. The last thing we want to do, Doctor, is open up, have another disaster, particularly over something that we can't control, such as a bunch of rowdy people on the sidewalk. We will do our very best. We will exercise whatever jurisdiction we can, including our moral authority, which we regularly do over those areas. But we have not worked out any additional protocol in that matter with the city or law enforcement.
Thank you.
Okay, thank you, Mr. Leroy. Any further questions from the board members for Mr. Leroy?
I do, Betty Ann. Thank you. This is Diana.
Okay, go ahead, Diana.
I'm not seeing anything in here about hours of operation, and all of us are learning a lot, more than we ever hoped to, about how this disease transmits. But we certainly know that one of the challenges we've had is that when people let their guard down and stop maybe being as diligent about distancing, face covering, hand washing, etc., that's how it passes, unfortunately. And so I'm just thinking about what the bar owners' thoughts are about potentially limiting hours. And that's something that's occurring in a number of states. I know it's not ideal from an economic perspective, but I'm interested in maybe some kind of last call cutoff that would be earlier than normal.
Madam Chair, Commissioner, we did not wish to propose, and we would prefer not to have imposed an arbitrary standard of some kind of cutoff. Each of our establishments is very different, but all of our establishments, by virtue of this protocol and the terms thereof in terms of physical distancing, term B, the education of our employees as to these policies and the enforcement of it, paragraph M, the security personnel interior of the bar enforcing these standards. We believe we can commit to enforce those standards at 7 o'clock at night, at 9 o'clock at night, and at 1 a.m. in the morning. And that is our commitment to so do. An arbitrary cutoff is, as you note, of great economic consequence. And because it's necessarily arbitrary and abstract, we believe we can do a better job with these kinds of specific and disease-related protocols than we can with some kind of arbitrary cutoff, particularly those that have potentially significant economic consequences.
Madam Chair.
Yes, Representative Blanksma, go ahead.
Thank you. I just wanted to suggest that maybe if we got the presentation by staff, the recommendation that some of the responses that they have will answer some of the questions that have already come forward. And so maybe that in the interest of time management, we can move along and then ask the questions at the end.
Okay, thank you. Mr. Leroy, is that agreeable with you and your clients?
Madam Chair, it is.
Okay, thank you. Okay, well, we will proceed down here by presentation by staff.
Madam Chair, this is Russ. I'll be the only one presenting. Is it okay to start?
Yes, go ahead, Russ.
Okay, you know what the proposal is on the table. Mr. Leroy covered that in some good detail. I want to start with as far as the criteria we're using for modification to community quarantine and restriction orders was if reported cases were greater than 25 per day on average, which is, we're still seeing that. But the idea was to lessen quarantine restriction when the hospital criteria as far as admissions, the disease criteria as far as cases, and then another disease criterion, which is clusters, publicly declared clusters in the community that had the potential to spread the disease in a significant way. So at this point, I may have mentioned this on Tuesday, that we are seeing downward trends both at the hospital level as well as our case counts. So it's appropriate at this time for the board to consider modifying the orders in such a way to make them less restrictive, or in the case of bars, the quarantine component, which is closure. So starting, I just want to go over just a real quick history as far as how this played out. Mr. Leroy alluded to that when the bars opened in early June. It wasn't long. We had a lot of cases coming out of the bars. As I recall, there were 10 individuals who were infectious that visited multiple bars over the course of a weekend, 10 individuals to be exact. And from that, we had several patrons from those facilities as well as staff who had become infected with COVID-19. The orders were implemented effective June 24th, and then, as was noted, there were subsequent orders, but in those orders, the bars were ordered to be closed. 4 consecutive weeks, which starting with June 28th, we had over 1,000 cases. Then on July 26th, it dropped to 910. August 2nd, back up over 1,000 cases. And since that point in time, we've had a steady decline, which is a really good indication in my mind that our communities are doing the things they need to do as far as physical distancing, face covering, stay home if you're sick, etc. August 23rd, which is the last full week we have recorded, we had 481 cases, and what we're seeing so far this week, we expect to have less than that, probably around 400. As was noted, there are bars already operating within restaurants. We've had probably 8 or so bars who have obtained food establishment permits from us to operate as a licensed food establishment. And again, primarily their function or business model is still a bar, but they are operating under certain parameters that we put forth. So I would say, you know, nothing we do in this pandemic is without risk. I think the proposal that is brought forward by Mr. Leroy and the clients he represents is well thought out and should provide a much higher level of safety and protection factor than what we saw back in June for certain. I would say obviously without these restrictions, which each bar will be required to submit a plan. Before they open, it has to be approved by my staff. And the other part of it is our staff are continually monitoring the diseases, doing a disease investigation, and then contact tracing. So this is not going to go unchecked if we start to see clusters of cases coming from specific businesses, including the bars that would be authorized to open if this proposal is approved. Then my recommendation would be to once again issue orders of quarantine for the protection of our community. So with that said, it is my recommendation that the agreement be approved by the board as written. Commissioner Lasciando brought up a couple of points, and I would note that those are already included in the orders as far as social gatherings are limited to 10 community-wide, so that would certainly apply in a bar setting. And the other thing that she brought up appropriately was face coverings, and face coverings are required again in a broader community except while eating and drinking. So it'd be our expectation with our existing orders that patrons entering, exiting, getting up from the table to use the restroom or getting up from the table to place an order, that face coverings would be required at that time, again per existing order. The last thing I would say is that with the timing, you're all aware that the White House has continued to designate Ada County in red. Central District Health, using criteria put forward by the state public health, has designated our schools, our 3 school districts, in category 3 or red. I do expect that to change. We are looking at a much simpler version of monitoring and measuring community transmission than what we have been using. We're going to put that out to the public by way of a press release tomorrow. I do expect, again, based on what we're seeing the last couple of weeks, including this week, that Ada County school districts will be designated in category 2 next week. I don't want to say that for absolute certain because things could change over the next couple of days, but our data so far looks really good. So again, with the restrictions that Mr. Leroy described and the current orders that would apply to them as well, it's my recommendation that the board accept the proposal in the petition, and then the other decision would be, if you do accept it, is the timing. Madam Chair, that's the end of my presentation.
Okay, thank you so much, Russ. We will now allow any responses to the board, questions by petitioners and staff. Are there any further questions?
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So I guess in terms of the face coverings, group size, the devil's in the details in terms of how this gets operationalized and what's the staff's plan to, especially as we are potentially looking at not just this group of bars, but countywide, what's the plan to communicate with and ensure that these elements are followed?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
So what we would do is, obviously, we get members of the public who routinely communicate with us as far as what's going on, and we follow up on the complaints. We usually do that through a phone conversation. And if we continue to have issues with non-compliance, then that is something that we would attempt, as we have in the past, to work with law enforcement on. There are no provisions in place right now as far as non-compliance. If we have a bar, for example, that's open and no face coverings by staff, no limitation of group sizes, it's our expectation that law enforcement would enforce our orders in those situations.
Okay, thank you, Russ.
Russ,
Any further comments or questions for our petitioners?
Russ, this is Diana. One more question about my hours of operation question. I'm sure you've been tracking that around the country. Some states, some localities have limited hours of operation. I could make the argument either way in my mind. I know that for some young people, if they're not at the bar, they're going to be at the house party. So maybe it's a more regulated environment. Based on what's proposed, but I'm very interested in what your thinking is there.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yes, and I am aware of the restrictions that you just described, Commissioner Lasciando, and I think that there's not really great data to show if you close at 11, you greatly reduce the risk. I think if the bars do their job, which they're requesting the opportunity to do, and using security staff to enforce the orders, you know, it's my recommendation to give them that opportunity. And if they don't, I think it'll become very apparent very quickly with the increase in cases and trace back to specific bars. And in that regard, I think we do have problem bars that continue to not follow the orders. That's another opportunity for quarantine for those specific facilities rather than doing it district-wide. I think that, or I shouldn't say district-wide, but Ada County-wide. I think we have enough data and enough experience now. We could even further pinpoint the problem areas versus the county-wide issuance of a quarantine order.
Okay, thank you, Russ.
Madam Chair, this is Ted Epperly. A question for Russ.
Yes, Ted, go ahead.
Russ, we know that back on June 5th and 6th, when we had roughly 10 individuals that created 37 cases that led to weeks of over 1,100 cases per week in Ada County. We know those events were serious. We've all seen the repercussions of that. We now have in Ada County over 11,000 cases. We've had 128 deaths. We know that the case counts still are in the red zone. We still have 480 cases in the week before this one. We're looking at perhaps 400 cases this week, knowing that we want to get down below 25 cases a day, which would be roughly 175 cases a week. We're roughly still 2.5 to 3 times too high. How do you and your staff feel, Russ, in regards to opening bars before we even open schools, in regards to knowing the risk and that our case counts are still too high?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, thanks for the question, Dr. Epperly. You know, like I mentioned, it's taking actions where you make things less restrictive or allow businesses, for example, in this case, bars, to reopen. It wouldn't even be a consideration if there wasn't an agreement in place to take all the precautions that Mr. Leroy described. There's a lot of risk areas out in our community where we're seeing most of our cases coming from right now has been family spread within the household. That's to be expected, as well as we're continuing to see concerns coming out of the social gathering. So, you know, that timing certainly is a factor. As I mentioned, I expect if our cases continue to trend as they have so far this week, and you know, cases will continue to come in today. As you know, labs report out well into the evening. I would still expect our cases to be low enough that next week, Tuesday, because Monday's a holiday, that we'll probably, I would say almost certainly, be designating our Ada County schools in category 2 or yellow. So, you know, again, that's a consideration. I'm like you, I would rather the cases be under 25 per day or even fewer than 5 per day, like what we were seeing back in late May or June. The one thing I will say is when we had the 1,100, you know, over 1,000, some days over 1,100 cases over a week period of time, you know, you're well aware as a healthcare provider, our hospitals were impacted at that point, and it doesn't take long to get there, a matter of a few weeks. and the cases continued to rise rapidly. It seems like when the orders went into effect, I can't remember the exact numbers, but we were probably looking at 50 or so cases, and then all of a sudden we're over 1,000 cases. So something we need to keep in mind for sure. Yeah, I guess I do feel like that with the restrictions that were described, that if the bars are sincerely committed to taking the steps that they're proposing, they'll look very much like restaurants in the way of how services are provided and the precautions taken by staff and the enforcement taken by the security of the bars. I think it's appropriate to seriously consider this petition that they put forward.
Madam Chair, this is Representative Blanksma.
Yes, Megan, go ahead.
A question for Russ, if you please.
Yes.
Russ, I guess my question is, if we approve the petition to reopen, at what date would you recommend that reopening occur?
Madam Chair?
Yes, Russ, go ahead.
My recommendation would be to do that on Tuesday, I believe it's September 8th. And I'm quite confident our schools will be moved into the yellow category. If for some reason they weren't, I would delay that till a later date until the schools are. I think, that's a really tough situation where our schools are currently virtual in Ada County and we allow businesses to open at this point in time. That would be my recommendation, Representative Blanksma.
Madam Chair, this is Diana.
Diana, go ahead.
Could I follow along on that? And I guess I want to come back to something.
Madam Chair, point of order.
Yes.
This is supposed to be a question answer period. We don't have a motion on the floor. If we want to discuss the motion and the petition, then it would be more appropriate to have a motion on the floor.
I have a question. So thank you. So last week, one of the things that we talked about was there's all kinds of different things that either add to or take away risk within the larger community. We're all bound together in all of this. And so Russ, I'm wondering if it makes sense sort of going forward to even sort of tie bars to where the schools category is. Just wondering that we kind of can't have everything all at once. And if we can't have school, if we go back into red, I'm really wondering how we can have bars, knowing that that is a high risk environment. And it for me is going to require the larger community to really be thinking about this holistically so that we can benefit both our kids and our businesses. Russ, does that have any merit on from your book of business?
Madam Chair?
Yes, Russ, go ahead.
Yeah, Commissioner Lasciando, I think it does. We are going to continue with the restrictions of gatherings no greater than 50, both public and private, limit social gatherings to no more than 10. Large venue events will continue to remain prohibited. And there's others such as visitors to long-term care facilities being prohibited. So I don't feel like this step is the same as doing away with the orders of restriction, but it is a step that I think we could take with careful monitoring and the expectation of good compliance. And like you said, there could be some merit in that. The White House still has Ada County in red. I'm not sure when that'll change. But if we do see an uptick in cases and schools are back in red, what other restrictions might the board consider? It might be appropriate at that point in time to reimpose certain restrictions or a quarantine. And it might not just be bars, or maybe other areas where we're seeing problems.
Madam Chair.
I'm
Madam
sorry.
Chair, this is Ted Epperly here.
Yes, Ted, go ahead.
Okay, thank you. I know several people have questions. Russ, another question for you. And, you know, I'm very sympathetic to the issue. I get it. We all get it. We want businesses reopened, but we want them reopened safely. And this is a timing issue. That's the issue. Nobody has it in for bars or nightclubs. It's a timing issue in terms of community involvement and when is it safe to do so. Russ, have you or your staff considered, when looking at the data, and I'm very pleased to hear that we might be able to take the 3 school districts back to yellow next week. Have you or your staff considered a formula of school reopen plus, let's say, 2 weeks in regards to then opening potentially high-risk businesses such as bars or nightclubs? The reason I say this is that to open them both simultaneously on or about the same day may be problematic. And the thought goes like this: schools get back to business, which we all want them to do, face to face. It's going to take a couple of weeks for cases to start to spin up. We know the cycle of coronavirus and how that works. It's going to be about 2 weeks in terms of kids getting sick, teachers getting sick, and spreading it both into the community into schools. It's a bilateral thing. Have we considered a reissuing of and reopening of schools, waiting about 2 weeks, seeing what happens, and then contemplating the potential high-risk businesses? Because if we do it at the same time, I'm concerned that it's going to be all of a sudden a major issue, an impact issue. We already know testing is a bit overloaded. We now have schools, we now have bars, we now have cases. We're trying to track. There's a lot going on.
Chairwoman, please. I really feel I need to admonish the committee again. There will be plenty of time to debate and to discuss opinions, and I understand people have really strong opinions. But if we're going to ask questions, at least give the opportunity to answer the questions.
Well, if I'm not interrupted, I'll finish the question, if you don't mind. So, Russ, have you and the staff considered a timing issue here between schools and other high-risk businesses such as our bars and nightclubs?
Madam
Yes, Russ, go ahead. I'm getting a fair amount of feedback here. I'm having trouble.
Sorry about that. Yeah, is it okay to answer the question?
Yes, go ahead.
Dr. Epperly, we haven't actually looked at that, what you described. The current, from a business perspective, bars are the only area that's specifically closed, but as you properly noted, there are other businesses being affected by this, such as those who cater to large gatherings or sporting events. So we actually haven't done that. I will say, as the board is aware, we work really closely with the schools. I think they have great plans in place. The students are required to wear face coverings by way of our order. I think they have good plans for physical distancing. The universities just went back in session, just like at Boise State University, for example, and they have really great plans in place for what they can control, which would be on the campus, and off-campus student behavior. If there are issues that get reported to them, they can take proper steps. So, you know, I think it's not a bad idea for certain, but it's not something we've discussed or explored.
Madam Chair, this is Al.
Yes, Bill, go ahead.
You know, it seems to me like when we started this out with the restaurants and they adjusted and they social distance, and it's worked, I think, pretty well with the restaurants. And we've done it with the schools. And we don't really know for sure if it's going to work, but we kind of think it does. And now we're doing it with the bars where, you can open under these guidelines, and I think we should give them a chance. In fact, I'm going to go ahead and make the motion that we approve the petition and we allow them to open right away. I don't think it does any good to wait a week or 2 weeks or 3 weeks. We need to let them have an opportunity to make it work for them. And
I'll second the motion.
Who seconded?
Representative Blanksma seconds the motion.
All right. Thank you, Elt. The motion has been made and seconded. I will go ahead and take a roll call vote by county, starting with
Have
Elmore.
discussion on the motion.
Yeah, we need discussion.
Go ahead. Who's speaking? I'm getting some feedback here. I can't tell who's talking.
This is Diana.
Diana, go ahead and make it brief, please. I'm going to limit your time.
Okay. So I, similarly, I feel for our small business owners. This is our county that our people are hurting. I feel for the employees. I cannot in good conscience say open immediately when we have kids and families who are struggling with no in-person learning. So I would not be supportive of this particular motion. I could be supportive of a motion that incorporated timing that's reflective of when schools are in the yellow zone.
Okay. Any further discussion?
Betty Ann, this is Ted Epperly.
Yes, Ted, make it brief, please.
I'm also against this motion. We already are about 2.5 to 3 times too high in terms of case rates. We don't even have the schools open yet. I'm in favor of a motion that would be a timing motion so that we open sequentially schools and then bars, not to do this simultaneously or immediately.
Okay, thank you. Any further discussion? Hearing none, I will take a vote by county, starting with Elmore.
Representative Blanksma votes yes.
Ada County, Jane Young.
Jane Young votes no.
I'm sorry, Jane, I couldn't get your vote.
Jane Young votes no. Can you hear me?
Yeah, I could hear you. Okay, and all right. Ted Epperly,
Ted Epperly votes no.
Valley County.
You forgot me, Jane. Or excuse me, you forgot me, Betty Ann.
Oh, okay, Diana, I think you already registered your vote, but go ahead again.
Hey, no, I didn't. But Commissioner Laciando votes no.
Valley County.
Mr. Hasbrook votes yes.
Okay, the motion fails, and so we will not be allowing this plan to move forward at this time. Russ or Mr. Leroy, would you like to comment, have the floor at this time?
Commissioner, I can make a comment. This is very, very, very disappointing. I understand your concerns and I understand your mission to protect the public. But timing is an issue, and I did not go into the economic consequences bar by bar, employee by employee. I hear your very well-meaning concerns about timing, but it seems to me that sequencing the schools and the bars, where we have in place the proposal to make the bars, with all due respect to Dr. Epperly, at least no more risk than restaurants or some of these other operations that are interfacing on a regular basis with the public, is to consign them to that economic certainty of defeat and closure and the resultant circumstances. For 150 of the last 165 days, bars have not been a factor in this equation, and for 75 days, they have not been operating in the immediate recent past after a roughly 2-week opening in June. We can work with your staff We have counseled with your staff to create this proposal. We have the approval of your staff or endorsement of this proposal. And we have monitoring by your staff that ought to be with great acuity, able to discern what is a school-related cluster and what is a bar-related cluster, just as they did back in June. So I am most hopeful that the suggestion implied by Commissioner Epperly and Ms. Laciando is that if we get to schools yellow next week, this matter can once again be revisited next week, because we very well will have 7 of these bars next week and 4 of these bars the week after, and each of them losing their lease, economic consequences, and 25 employees on the street approximately for each such bar. So you don't need a lecture from me, but I am telling you that we are disappointed and we face disastrous consequences. I ask you to revisit this and revote this as early as possible, and it is necessary that you do so if we will maintain a viable bar community in our county. There are 54 enterprises, less those that have obtained a restaurant license by putting in a hot plate or a pizza oven. And we need your help, and we need it now, not in some future theoretical time scheduled for what happens in the schools, with all due respect. Thank you.
Madam Chair, this is Diana. A point of clarification, please.
Go ahead, Diana. Make it brief. I'm going to call for a motion to adjourn.
Well, this is a question for Mike. I would be prepared to make a motion to open bars when Central District Health designates schools in the yellow zone. I hear Dr. Epperly and wanting to time it even further, but as Russ noted, I think that we have other things that we have closed off in the community. So I'm wondering if that holds up from a legal perspective, Mike, if we were to make that motion today.
Madam Chairman, yes, it does. The agreement specifically contemplates that the board would have the ability to modify the proposal in any way that the group saw fit. So it is absolutely in order for you to do that.
Okay. Well, with that being said, Madam Chair, I'd like to make a motion.
Go ahead.
Okay. I would propose that we adopt the Central District Health reopening plan for bars in Ada County, conditional upon the data showing that schools are in the yellow zone for Ada County.
Okay. Is there a second to the motion?
This is Jane Young. There's a second.
Any further discussion before I call for a vote? Hearing none.
Betty Ann, just a really quick question for Mike Kane, based upon how the motion was stated. Does this mean that these opening orders for bars are now permanently tied to the red, yellow, green conditions for schools, or is it just for the initial opening based upon this motion?
Madam Chairman, my impression based on the motion that it was simply to begin the process and does not tie it at all to anything else. It states a date of opening. I should also remind everyone that the district in the agreement would have the ability to pull back at any time based upon conditions on the ground.
Okay, thank you, Mike.
Madam Chair,
Okay.
Russ?
Yes, Russ, go ahead.
Yeah, just one other real quick point of clarification. Even though that if this motion were approved, schools were designated yellow next Tuesday, the bars do have to submit and have plans approved by Central District Health before they actually can open.
Okay, does everybody understand that?
Yes.
All right, okay, let's call for a vote on the motion to move the bar, go ahead, when the schools move into the yellow category, that the bars can apply to reopen too. So, is that stated correctly, Russ? Okay, Elmore County?
Representative Blanks, my vote.
Ada County,
Jane Young, aye.
Ted Epperly,
Ted Epperly, aye.
Diana Latiando.
Aye.
Okay, Valley County.
Commissioner Hasbrook, aye.
Okay, thank you. All right, I think.
Madam
that's probably-
Chairwoman,
Yes, Megan, go ahead.
motion to adjourn.
Okay, motion to adjourn has been made. Do I have a second?
I'll second. This is Al.
Okay, thank you. Any further discussion? Hearing none, I'll call for a motion to adjourn by county. Elmore County,
Representative Blanksma votes aye.
Ada County,
Jane Young, aye.
Ted Epperly, aye.
Diana Latiando, aye.
okay, thank you. Valley County,
Commissioner Hasbrook, aye.
okay. Thank you, motion passed. And at this point, folks, our next regular meeting is scheduled for September 15th at 5:15. So I thank everybody for their participation and cooperation. And the meeting is thus adjourned. And have a good evening. Bye now.
Stay well.